But you know what's not fun at all, is to get injured when you're out doing a sport. Not so fun. And if you or the kids are into playing hoops, you definitely want to be safe. You want to try and do everything you can to prevent injuries. Dr. John Henry from Aurora Baycare has some tips on how to keep from being injured on the basket.
Hi, I'm Dr. John Henry. I'm an orthopedic surgeon specializing in sports medicine with Aurora Baycare.
Hi, I'm Elan Bakarma, a licensed athletic trainer with Aurora Baycare Sports Medicine.
Today we're going to talk to you about ACL injuries in female athletes. Compared to male athletes who typically tear their ACL from a contact mechanism, such as in football, most ACL tears in female athletes occur from a non-contact mechanism, such as a sudden stop or change in direction on the field or court, or an awkward landing from a rebound. These typically occur in cutting and twisting type sports, such as basketball and soccer. If we can use this knee model for demonstration purposes, here's the femur, the thigh bone, the tibia, the shin bone. If we pull the kneecap to the side, we can look inside the joint and see the anterior cruciate ligament, which is a structure that connects the tibia to the femur. The role of the ACL is to provide stability to the knee in the front, back, and rotational directions. Once torn, the ACL does not heal itself and leads to recurring problems of giving way, as there's an abnormal shift between the femur and the tibia. The individual experiences pain and instability and is normally unable to return to sports. Often there can be damage to the cartilage as well, which, untreated, will lead to early arthritis of the knee. The goal of treatment for the individual with an ACL injury is to prevent instability episodes, restore normal knee function, and enable safe return to sports or other activities. For the functionally active individual or athlete, this usually requires surgery, followed by 4 to 6 months of extensive rehabilitation and rigorous training.
Extensive research shows that female athletes are 2 to 6 times more likely to tear their ACLs than male athletes. There are many reasons or theories behind why this may occur, but the most convincing theory is that there's a neuromuscular component to it, which is a coordination issue with regards to how the muscles around the knee support the landing, as Dr. Henry recalled with rebounding of the basketball. On the upside, the nice part about the research is it also shows that ACL injuries may be prevented, at least many of them, may be prevented with the proper preseason training and screening. And fortunately here at Aurora Baycare Sports Medicine, we do have the ability to do this screening, and I'd like to take you into our video analysis room where we can demonstrate this. Here in the video analysis room is where we do the screening process. So we have the ability with several different cameras to catch the athlete at several different angles. So one of the tests I like to do is have the athlete do a jump down into a max vertical jump. And that's what I'm going to have the athlete do right now. So if you can prepare yourself, I'm going to have you jump off the box, land, and then jump straight back up into the air. Perfect. So there's a few things that I'm going to be looking for, and sometimes it's hard to catch on the naked eye. That's why we like to use the video analysis room, so we can catch that on our TV. And what it allows me to do is, with our software, slow the movement down, and I'm able to pick out those discrepancies that I'm looking for. So you can see that once she jumps off the box, we're looking for that little knee collapse that we talked about. So she did collapse on both sides of the knees, which is going to lead me to believe that she has that neuromuscular imbalance or that coordination issue we discussed earlier. So from this test, I'm able to identify those athletes or individuals that may be at risk for ACL injuries, and from there I can build a program designed or curtailed to their certain activities and ability level. Such activities would include our treadmill workouts, which doesn't only work on strength, it also works on technique and good form. And that's a big key, or the common thread, is teaching the athlete a new way of biomechanically telling their body how to land, how to jump. So it provides good feedback, especially with the mirrors and, again, the software that we have available. Another component of the program would be the plyometrics floor, which is crucial in teaching the athlete how to move their body better or with more control. So from here, in a safe environment, I can train the athlete to move left or right, side to side, back and front, up and down, prepare them now so that when they are on the field, they're not thinking about it. It's just their new pattern or their more controlled movement.
We hope that you now have a better understanding of ACL injuries in female athletes. This can be a devastating, often season-ending injury, which in many cases may be preventable. If you'd like to learn more, feel free to access our website at www.aurorabaycare.com under the Sports Medicine section, Or if you'd like to schedule a free injury assessment or screening exam, call our rehab department at 920-288-5400.